Hi, this is Dr. Sara Siddiqui, and I'm here on behalf of the Elwood Public Library to present this month's discussion regarding alcohol and substance abuse in adolescents. And I'd like to thank the Elwood Public Library and everybody watching for me to allow to be participating and giving information. Let's get started. So the title of my talk is called Adolescent Alcohol and Drug Use. Let's see. Again, my name is Sara Siddiqui. I'm a pediatrician at the NYU Langone Huntington Medical Group, and I'm in the Department of Pediatric and Adolescent Medicine. And first of all, I just want to make sure that we know that there's no disclosures, meaning that I don't have any endorsements and I'm not getting paid for anything that we discuss. And this discussion is for informational purposes only. Please discuss with your primary physician or pediatrician regarding specific medical care for your child. And I hope this discussion helps. Again, if you have any ideas about future topics, please get in touch with the reference desk at the Elwood Public Library. So let's get started. So some facts. The 2019 Youth Risk Behavior Survey. So this survey is given out every year. I believe the 2020 data should be out too, but it was found that more than a quarter of high school students drank alcohol in the 30 days before they took the survey, and 1 in 7 reported binge drinking in that same time period. So this is an important topic to be discussing. Some facts about alcohol and drug use in adolescence. So why are we worried, or why do we like to talk about it? Why are we discussing this? Well, because it is a little bit of an issue, and many youths admit to trying alcohol and drug use in their childhood age. So youth drug abuse is a high-profile public health concern, with at least 1 in 8 teenagers abusing an illicit substance in the last year. Drug use among 8th graders increased 61% between 2016 and 2020, and this data is from the drugabusestatistics.org regarding teen drug use. By 12th grade, 62% of teenagers have abused alcohol, and 50% of teenagers have misused a drug at least once, and 43% of college students have used illicit drugs. 86% of teenagers know someone who smokes, drinks, or uses drugs during the school day. So this is significant. Youth drug abuse. These trends may provide clues about future public health as well as efficacy of educational initiatives. So these are data that we get year to year, and this is from the 2021 Youth Drug Abuse Survey, or Youth Survey on Drug Abuse. So remember, these surveys are done voluntarily. They're given to youths across the country in the middle school and high school setting. They ask everything from marijuana, vaping, alcohol abuse, cocaine, amphetamines, opioids. And so it's reliant upon the students that are surveyed. And we always have to remember that some of these surveys are maybe a little bit underreported, or the data might be underreported, but it is a good measure year to year to kind of see trends of what we're seeing. So almost 13% of all 12 to 17-year-olds report using marijuana in the last year. Almost 3% report misusing pain relievers. So these are opioids usually. And close to 800,000 12 to 17-year-olds met the criteria for illicit drug use disorder, which we'll get to the definition of in a few slides. And this age group is nearly twice as likely to suffer from illicit drug use disorder than they are to meet criteria for alcohol use disorder. So there's very clear criteria that we use to define these two things. So the reason why we do get concerned and worried about drug use and alcohol use in the adolescent time period is because the adolescent brain is so different from the adult brain. I always joke sometimes and say that the adolescents are one of my favorite age groups. I enjoy seeing all the age groups, of course, but the adolescent age group is really my it is really the most interesting in terms of their brain growth. So they have not completed their great brain growth, but of course their bodies have grown, and they sometimes appear like adults, but their brains are not fully developed yet. So the main part of the brain that really needs to develop still is called the prefrontal cortex. So just to kind of go through this slide, from early adolescence through the mid-late 20s, the brain develops somewhat unevenly. And there are some parts of the brain that develop first that control physical activity, emotion, and motivation. But the prefrontal cortex, which is responsible for impulse control, more reason, thought, and good judgment, develops later, much later. Sometimes it can be until 25. So this pattern of brain develop helps to explain some of the common traits of our teens. Difficulty holding back or controlling emotions, preference for high excitement, new activities, inadequate planning, and limited judgment in certain situations, and more risky and impulsive behaviors. So the voice of reason, or your part of your brain that says, well, maybe I shouldn't really do that, is not developed as much. And actually in adolescent brains, this can be helpful sometimes. Because they're the risk takers and the ones that take initiatives, they do think outside the box, and they do kind of are able to solve problems much easier than some adults can, because they tend to look around, they tend to think not the normal pathway and not the normal kind of in the box way that adults can. So it does lead to unpredictable and sometimes risky behavior. So this has always been the worry for people that get concerned about adolescent alcohol and drug use. So again, the prefrontal cortex is the part of the front of the brain that kind of controls our impulses and risk taking, and it's not fully developed. And because the adolescent brain is not fully developed yet, there are effects of alcohol, nicotine, opiates, and cannabis that are different in the adolescent brain than the adult brain. And it sometimes can change neurologic pathways that are developing because the brains are still growing and the neurons are developing, the neural transmitters and the tracts are still developing. It's sometimes easier to become addicted to certain substances if started in early youth or younger than 21 or 25. And there's changes in brain pathways, and sometimes there's even learning and cognition changes for chronic and frequent use of certain alcohol and certain substance abuse. So again, the adolescent brain, I feel like I just want to go over it a little bit more, that they do have difficulty holding back or controlling their emotions. They have a preference for high excitement and high risky behaviors. They like to explore new activities. They're very curious, and they just sometimes don't have adequate planning, or they're not thinking long term. They don't really think that their behavior will put themselves at risk or others at risk, and they can be very impulsive. And why do adolescents try drugs? Well, there are different reasons. Sometimes they feel that they can fit in. They not only do they do what their peers and their friends think of them matter, but it really does is important to them. So they do want to not only fit in, but want to kind of be part of what's going on. They want to feel good. Some of these substances, specifically nicotine and sometimes marijuana, even alcohol, make us feel good in the short term. And like we were saying before, sometimes when the brain is still developing and you continually give these feel-good kind of drugs and chemicals that are in your brain, it can change how your brain needs those chemicals and drugs. And sometimes we do get dependent on them when we start early because our brain is so used to having those chemicals around, and it may not release our own hormones that help us with that. To feel better, to do better. Sometimes our performance are improved with certain substances, specifically amphetamines have been abused quite frequently, sometimes in our high school and especially college age students. They see an improvement in their grades when they're using these substances when they may not need to, and they improve their performance. And sometimes it's, again, the risky behavior or the experimentation that draws the kids to do this. And this is from the National Institute on Drug Abuse, which is a very great website. I'm going to list the websites, or the websites are listed on here as well. If you just click on the links, you'll be able to access the websites that I'm referencing as well. So they want to fit in, they want to experiment, they want to be unique, but they also want to rebel. They want to, and they're very curious. So they may be the first in their friend group to try something, and then kind of the rest of the friends also try some of the substances or alcohol. And what can parents do? So we are going to get into this a little bit later as well, but it's really important for parents to set the tone early on, and not setting the tone in a judgment kind of way, but really listening to your children, really making sure, but with multiple conversations frequently and starting very young, about what your thoughts are on alcohol and drug abuse, and what the behaviors can result in, what can happen if we start earlier rather than later. And it's really important to not do this in a very punitive type of way, and not do this in a prying way, but in an open kind of non-judgmental forum, because it's difficult sometimes to talk to children of this age group. That's why it is important to start early, so that you can have these conversations when they are more accepting of some of the things that you may say, because as adolescents grow a little bit, become more independent, they're less likely to kind of just listen to what you're saying. But it is really important to develop that communication and that relationship very early on. And it's definitely important to set boundaries, set rules, and set some structure in what's expected and what they should be doing. So alcohol, and this is from let me just put teenage drug use and statistics data. So alcohol is by far the most commonly abused substance among teens and young adults. Almost 1.2 million 12 to 17-year-olds report binge drinking in the last month. And this is 2021 data. Almost 12 million 18 to 25-year-olds report binge drinking in the last month. And 7 million 12 to 20-year-olds report drinking in the last month, a single drink. And among them, 60% report binge drinking in that period. So 12 to 20, so 60% of the 12 to 20-year-olds that reported drinking reported binge drinking. 25% of 8th graders have abused alcohol at least once. Now, 8th grade, they're 14. And their brains are still not developed yet. And for them to start at that age and continue, it's more likely for them to continue on as adults, and may result in alcohol abuse as adults. 61% of teens have abused alcohol by 12th grade, so 60%. Oh, here we go. All right, okay. So what are some risk factors for addiction? There sometimes is a family history of addiction or addictive behavior. There's mental health concerns, behavioral or impulse control issues may lead to increased addiction of substances, exposure to trauma, environmental factors, where we are, what our family is going through as well, age of first use. So again, like I mentioned about the 8th graders abusing or using alcohol for the first time, it is something that can lead to further addiction if we start younger. So 90% of people with addiction started in the younger years. mental health. The risk of alcohol use and other substances is higher when we suffer from mental illness. So it's really important to treat those underlying issues and try to recognize that that's happening. We did have a discussion on mental health and anxiety, or depression and anxiety, in our youth as well, which I gave out some resources at that time. So it is really important because these things do tie together very closely, mental health and drug abuse, and even in adults as well. And sometimes there's a genetic predisposition with the family history. So again, this is from National Center for Drug Abuse Statistics 2020, and we're going to talk about cannabis or marijuana. So marijuana is one of the most commonly used illicit substances among youth. 12th graders, almost 7% of 12th graders have used marijuana daily. Almost 45% have tried marijuana in their lifetime. 35% have consumed marijuana in the last year, and almost 3% have used synthetic or K2 or spice in the last year. 63% of 12th graders who used marijuana in the last year consumed marijuana via vaping. So we also did a discussion about vaping, and marijuana is one of the, marijuana and nicotine are most commonly used vape substances. And marijuana vaping has become a quite popular way to use marijuana. And 12th graders are 80% more likely to use marijuana in their lifetime than they are to smoke a cigarette. So cigarettes have gone down, but we have been seeing nicotine vaping as well as marijuana vaping on the rise still. People who use marijuana prior to the age of 12 are twice as likely to develop a mental illness compared to those who first used marijuana at 18 or older. So we are concerned regarding the legalization of marijuana, although for adults, it'll be legalized for adults, or it is. But for children, we know that it is not something that should be used in adolescents or children. Marijuana use that begins at an early age puts individuals at risk for mental illness. Sometimes there can be an underlying mental illness or psychosis disorder that can be brought about by chronic use of marijuana, but it can also put individuals at risk for it. And research shows girls who used marijuana daily were 5 times more likely to suffer from depression at age 21. Daily use in young women is also associated with significant increase in the chance of reporting a state of depression and anxiety. And 13% of young users will become dependent on the drug. So it has shown that there is some dependence of marijuana when starting young. And substance abuse affects teen brains. So again, their brains are still developing. So what we were saying prior regarding the prefrontal cortex and some of the neurotransmitters still developing and the pathways still developing, interfering with neurotransmitters and damaging connections within the brain, reducing the ability to experience pleasure. So again, we're using artificial chemicals or things that we input, and it's going to alter the way our own brain produces some of the chemicals like dopamine and serotonin that our brain needs and uses to feel pleasure and happiness. And if we're only getting that artificially, sometimes the brain turns off our own pathways or our own release of them. And in order to experience those without the chemicals, without the substances, then leads to feeling down and the child may need to use those substances, or may feel the need to use those substances more to get some of those previous pleasurable effects. It creates problems with memory, causing missed opportunities during a period of heightened learning potential. So these are the times when our brain is really ready to learn and grow and take in information in school. And if we're not at our highest learning capacity because we are using certain substances, it will alter the way we learn, and it will alter the way we input the data that we're supposed to be learning in school. And ingraining expectations of unhealthy habits into the brain circuitry. So it becomes the normal. Our brain gets used to some of the substances, and the milieu or the surroundings of the brain, or the chemicals in the brain that's surrounding the to promote the healthiest function is not there. It's altered. And then you need those same substances to continue in the same manner. So it's quite harmful for our brain to be used to some of these chemicals and some of these substances early on in childhood. So 12 to 18 is really like such a time where their brain is growing and has such potential, and then to have these substances introduced to the brain is very harmful, and for the long run and for the future. So teens how does drinking affect teens? So teens tend to be more likely than adults to binge drink, or they start drinking enough in a short amount of time to reach the legal blood alcohol content limit. So they want to drink fast and a large amount so that they can become they can feel the effects of drinking. Studies have also shown that the teen brain responds differently to alcohol than the adult brain does. So again, the brain is not developed fully, and so it's going to respond differently to these substances. So people who begin drinking during adolescence, especially those who drink a lot, are more likely to develop an alcohol dependence than those who don't. So that's going to become a long-term effect. In addition to addiction risk, alcohol poses a serious risk to physical health and growth of teens. So there's a whole nother conversation of what alcohol does to our bodies as adults, but to teens, it can result in delayed puberty and negative effects on the reproductive system, lower bone mineral density, higher levels of liver enzyme that indicate liver damage, shorter limbs, and reduced growth potential. So all these things, they're affecting the whole entire body. And it is something that is concerning, and long-term health effects. So alcohol and illicit drug use disorder. So these are DSM-5 criteria. This is in the psychology and psychiatry diagnosis criteria. And for alcohol, it's frequent drinking 3 or more days in the past week, loss of control over drinking, so difficulty stopping, and becoming forgetful after drinks, binge drinking, which is 5+ standard drinks in one day, and heavy binge drinking, 20+ for men and 11+ standard drinks in a day for females. So that's heavy binge drinking. And if that occurs over a period of time, then that is an alcohol use disorder. Substance abuse disorder is also defined as taking the substance in larger amounts or for longer than you're meant to, wanting to cut down or stop using the substance, but you're unable to. So the addiction part of it is there, and you don't want to do it, but you still feel like you have to, or you cannot stop, and spending a lot of time getting, using, or recovering from the use of the substance. So either you're thinking about how to get it, you're thinking about where you're going to get it, when you're going to use it. And so it's kind of taken over all your normal thoughts, and you can't think of anything else. So that is helps to define the substance abuse disorder. So what can parents do? So it's really important to educate yourself on how to talk to your children. Definitely make sure that you're having these conversations early and often. This is not something that you can talk about one time and kind of think that that's it. You want to have these conversations. Use whatever is surrounding you. If you're watching a movie and there's someone drinking in the movie, maybe talk about it then. If there's someone vaping in the movie or someone smoking, same thing. Use those kind of things to introduce the topic. Maybe when you're dropping your child off or picking them up, start the conversation, say you read something or you saw something and you just want to discuss it. A lot of times children may not want to talk at that time, but they're listening. If they look like they really are not willing to speak or not willing to talk, then don't push it. Try to be as non-judgmental as possible, and try to be as non-prying as possible and understanding of what they're saying. Explain outcomes of risky behaviors, set some good examples, be supportive and open to communication. And again, start talking about alcohol and drug abuse early and often. So as you saw by the data, 12 years old, they're already getting exposed and even possibly trying it. So that's 6th grade. And you want to try to speak to children younger than that, before they get exposed to it. And multiple conversations. I can't say enough for that, for everything, not only drugs, alcohol, just to open that line of communication and keep it open. Understand that adolescents want to take risks, understand their brain, understand their where they're coming from, how important their friends are to them, and how important it is for them to be able to communicate and socialize with their friends. And you have to kind of give them that freedom, but you also have to give them the responsibility, or let them know that this is what can happen if you try a substance. And try to identify alcohol use disorder or illicit substance disorder, as I shared in the last slide. And what are some conversation goals that can help you get started? Show that you disapprove of underage drinking. Don't make it easy for them. Don't try to be friends and be part of the party and drink with your children. It's try to make it difficult for them. Are they going to have access to it? Yes, but try to make it difficult for them. Show you care about your child's health, wellness, and success. Push them to strive to be better and to better themselves, better their health, and push them in sports. So that always kind of helps to get them to remember to think about their body and the health of their body, and giving their body, they only have one body, giving them the nutrition and the optimal things they can to make their one body that they have, to take care of it. Show you are a good source of information about alcohol and drugs. Show that you're paying attention and will discourage risky behavior. So you really want to, without prying and getting into their things, but you do want to ask them questions. If they're coming home from somewhere and they're, maybe looking like they may have had something to drink, ask them about it. Maybe take care of them at that time, but the next morning, maybe discuss it with them. And build skills and strategies for your child to avoid underage drinking and drug abuse. So kind of go through some sample scenarios that may help to guide them. Again, they are going to be put in situations where they're going to be offered certain things, and it is important to make sure that they know what to do. They know that they can call you, and maybe you can go and pick them up, and make sure that you are available if that happens. So that's really important. Sometimes for alcohol use, you do want to look for some of these signs. So has your child's drinking or being sick from drinking often interfered with their responsibilities, such as at a job, school, or at home? Sometimes the kids that go away to college and come back, they may have tried certain substances away, and then they kind of continue to use those while they come home. And it's important for you to kind of identify that and speak to them about that. Does your child have times when they ended up drinking more or longer than what they wanted? And did they want to cut down and stop, and they're having difficulty doing it? Or does your child spend a lot of time drinking or being sick from getting over a hangover? Has your child experienced a craving, like they need to drink, they really want to drink, they're asking you if they can have a drink? Or does your child continue to drink even though it causes trouble with family or friends? Even if you've identified that there may be a problem here, are they continuing to do so? And has your child given up or cut back on activities that were important or interesting because they want to drink? And have they gotten into situations such as driving or using machinery, harming others? Have they gotten into a situation because they've been drinking? And this is all from drugfree.org, which was a great, had a lot of resources, and I recommend that you check them out. I left the link right on there. So what do we do when we're in trouble, when we find that our child does have an issue? I mean, you can definitely talk to us, talk to your pediatrician, talk to your healthcare provider, but I wanted to give these numbers. These are really, really important numbers that you can kind of go in a crisis. Obviously, you can always go to the emergency room, but there are some emergency hotlines specific for drug and alcohol. And the DASH Crisis Center is one of my favorite places to recommend. They are a emergency psychiatric and mental health crisis center. And they provide 24 hours a day, 7 days a week phone service. And they also have a center in Hauppauge, and they are a very, very great resource. In Nassau County, they have a hotline as well. The Long Island Crisis Center, Suffolk County Drug and Alcohol Hotline, and then that's supposed to be Response Crisis Center. That's also in Suffolk County. So check those out. There are some addiction resources as well. So DASH is very good, the Response Crisis Center, the Talbot House, but LICAD. So LICAD is the Long Island Council of Alcohol and Drug Dependence, Substance Abuse. They have a 24-hour hotline, but they also have many, many resources available. They have group therapy, they have addiction, they have small group treatments. They have they're not inpatient, but they're an outpatient recovery center. They also have volunteer hours. They have things for adolescents that they can help other adolescents. I have found that when in the healing process or trying to come out of an addiction, if a child can have volunteer opportunities or opportunities to talk to other children going through the same thing, or maybe when they're recovering to kind of give back, they find that this is very useful. So they do have volunteer opportunities in these places. So again, I want to end with just make sure that you keep track of your child and keep track of what they're doing. Communicate with them often. Keep your eye on what's going on. Talk to your pediatrician. Talk to us. We can help, and we can talk to your children too. We can give you some resources and guidance. It's important to treat any underlying issues as well when discussing alcohol and drug use in children and adolescents. And then finally, if you have any questions, please leave comments or questions below. Feel free to email the Elwood Public Library. They'll get it to me and I will answer them. I hope this has been helpful. I hope this is enlightening to you. I know it's not a very happy subject, but I feel like it's really, really important to know and to be aware of, and to make sure that, you know, we try our best to have our kids as healthy as possible. So thank you again. This is Dr. Siddiqui. I really enjoy doing these talks. I hope that you're getting the same amount of enjoyment, or at least some information, as I do in enjoying making them. All right, we're gonna stop sharing, and then we're going to stop the recording. Okay, great. Have a great day, everybody. Bye.